Have you ever walked out of the bathroom thinking you were finally done, only to feel that uncomfortable pressure return seconds later? That quiet, nagging sensation that whispers, "You didn't empty properly." For millions of people, this moment becomes a daily frustration. It interrupts sleep. It creates anxiety around travel. It quietly steals confidence. And perhaps the most damaging part? Many are told or assume that this is just what happens with age, something you're expected to tolerate. Today, I want to stop that belief right here. I'm Dr. Adriana Wells, and on this channel, Urology for You, we talk honestly about bladder health, comfort, and confidence. And in this video, I'm going to show you why frequent bathroom trips, weak flow, and that not fully empty feeling are not always inevitable. And more importantly, how a simple 60-second routine can help many people empty more completely and feel calmer in their body, often within days. Before I dive deep, make sure you like this video, subscribe to Urology for You, and press the bell icon so you don't miss future science-guided strategies for bladder health, circulation, and confident aging. Now let's get into something that can quietly change your day-to-day comfort. When bladder emptying isn't working smoothly, people rarely describe it in medical terms. Instead, it shows up as a collection of small frustrations that feel disconnected, but are usually related. You finish urinating, wash your hands, walk away, and suddenly feel like you need to go again. You wake up 2 or 3 times at night, each time passing only a small amount, yet the urge feels intense. Your stream starts and stops. You notice dribbling after you think you're done. You feel pressure low in the abdomen or a sudden urgency that seems to appear out of nowhere. And then there's the emotional layer, the part people rarely say out loud. You start planning your day around bathrooms. You avoid long drives or flights. You choose aisle seats automatically. You skip walks, social gatherings, or events because you don't trust your bladder. Over time, this creates a quiet sense of limitation, and that matters. One of the most persistent myths in bladder health is this: if I'm not emptying well, I need to push harder. In reality, straining is often the reason the problem continues. Yes, the bladder is a muscular organ, but emptying urine is not just about strength. It's about coordination, a precise conversation between the brain, the bladder muscle, the pelvic floor, and the urinary sphincter. When that conversation is interrupted by stress, urgency, rushing, cold environments, embarrassment, or even the subtle pressure of "hurry up," the body often responds by tightening, not relaxing. That tightening can be so subtle you don't consciously feel it, but it's enough to partially narrow the outflow, similar to trying to pour water through a hose that's being lightly pinched. Urine still comes out, just not efficiently. The result? Residual urine remains behind, triggering ongoing urgency signals. In men, urine passes through the prostate region. As years go by, even mild changes in that area can increase resistance. The bladder compensates by working harder and becoming more sensitive. Over time, urgency and incomplete emptying can develop, not because the bladder is weak, but because it's constantly working against resistance. In women, the most common contributors are pelvic floor tension, posture habits, constipation, childbirth history, chronic stress, and hormonal changes later in life. These factors can alter how the bladder sits and empties, even when there is no obvious disease. Different anatomy, same experience. The bladder doesn't always get the relaxed open pathway it needs to fully finish its job. The single most important shift. Here's the perspective change that often brings relief. Your goal is not to force the bladder to empty. Your goal is to create the conditions that allow it to finish naturally. Think of emptying like opening a door, not pushing through it. When people stop straining and start focusing on relaxation, positioning, and timing, the bladder often empties more completely with less effort. That's exactly what the 60-second routine is designed to do. This routine is best used at the end of urination, especially at night or during times when you tend to rush. It has 4 simple components: posture breathing, pause, gentle second release. It doesn't require equipment, medication, or force, only awareness. Step 1. Posture. Set the body up for success. If you're a man, I strongly encourage you to try sitting for this routine for at least 1 week. Sitting reduces unnecessary abdominal bracing and allows the pelvic floor to relax more fully. Many men are surprised by how much better emptying becomes. For women, sitting is already standard, but how you sit matters. Place your feet flat on the floor. If your feet don't rest comfortably, use a small stool or a stable object. Your knees should be slightly higher than your hips, not dramatically, just enough to allow the pelvic floor to soften. Now lean slightly forward, as if resting your elbows on your thighs. This is not a deep hunch, just a gentle forward angle. This alignment often improves urine flow without effort by optimizing the position of the bladder outlet. Step 2. Breathing. Signal safety to the nervous system. Take a slow breath in through your nose and let your abdomen expand gently. Then exhale longer than you inhaled, as if you're softly cooling hot soup. As you exhale, consciously relax your shoulders and unclench your jaw. This is not a relaxation cliche. The jaw and pelvic floor are neurologically linked. When the jaw is tight, pelvic tension often follows. Repeat this once more. Easy inhale, long, slow exhale, jaw soft, shoulders heavy. This tells your nervous system it's safe to let go. Step 3. The pause, the most important part. When the urine stream naturally stops, do not stand up immediately. This is where most people unintentionally sabotage emptying. The bladder does not work like a faucet. It works in waves. When the first contraction ends, a short pause allows the bladder muscle to reset and generate a second, smaller contraction. Stay seated. Maintain your gentle forward lean. Continue breathing normally. Now count slowly to 10 in your head. No pushing, no straining, just waiting. Step 4. The second gentle release. After the 10-second pause, make a very small movement. Gently rock your pelvis forward and back once or twice. Subtle, almost unnoticeable. Then, lean forward just a touch more and exhale slowly again. Many people notice a second brief stream begin on its own. This second wave is often the difference between "I'm done" and "I'll be back here in 5 minutes." When it finishes, pause for another couple of seconds, then stand up calmly. That's the entire 60-second routine. The bladder contracts automatically when the brain gives permission and the outlet relaxes. If the outlet remains tense, even slightly, the bladder either has to work harder or it stops early, leaving urine behind. This routine works because forward leaning aligns the bladder neck and urethra. Foot support reduces pelvic floor gripping. Long exhalation lowers fight or flight tone. The pause allows a second bladder contraction. Gentle pelvic movement releases urine trapped in small pockets. You're not forcing anything. You're allowing completion. More complete emptying leads to fewer repeat trips, especially in the evening. When residual urine is left behind, the bladder fills faster and urgency signals fire earlier. Emptying more fully resets that cycle. Better emptying before bed often improves sleep quality. Not because you drink less, but because the bladder stops sending false alarms during light sleep. Straining decreases, pelvic tension softens, and urgency becomes less dramatic. Over time, confidence returns, and confidence changes behavior, posture, and quality of life. And this is where things start to shift in a meaningful way. And once you understand that emptying is a coordinated skill, not a strength contest, it becomes easier to see why certain everyday habits quietly sabotage bladder function, even when everything else looks normal. Let's talk about those hidden obstacles, because removing them often amplifies the benefits of the 60-second routine dramatically. Hidden obstacle 1: constipation and sluggish bowel patterns. The bladder and the lower bowel share physical space and nerve pathways. When the bowel is chronically full, even mildly, it can press against the bladder and alter how the bladder neck opens during urination. Many people with incomplete emptying also report bloating hard stools, straining during bowel movements, going less frequently than feels natural. Even if this doesn't feel severe, it matters. When the rectum is distended, the bladder may not empty efficiently. and urgency signals become more intense and less accurate. The solution doesn't need to be extreme. Small daily habits help. Drink more fluids earlier in the day rather than late at night. Increase fiber gradually, not suddenly. Walk after meals to stimulate bowel movement. Avoid ignoring the natural urge to have a bowel movement. Improving bowel rhythm often improves bladder comfort indirectly and quickly. Hidden obstacle 2: rushing and hovering. Behavior. Many people unknowingly tense their pelvic floor because they feel rushed, unsafe, or uncomfortable in the bathroom environment. This includes hovering instead of sitting fully, standing immediately after the stream stops, urinating while mentally distracted or stressed, feeling pressure to hurry because others are waiting. Pelvic floor muscles respond to perceived threat by tightening, even if that threat is subtle or habitual. Your retraining goal is simple. Permit yourself to take 1 full minute. You are not being inefficient. You are being physiologically precise. Hidden obstacle 3: breath holding. Breath holding is incredibly common, especially at night or when people are tired. Holding the breath increases abdominal pressure and reinforces pelvic tension. Many people don't realize they do it until they deliberately check. If you catch yourself holding your breath during urination, return immediately to the long exhale. The exhale is the nervous system's release signal. It unlocks the outlet far more effectively than pushing ever could. Hidden obstacle 4: just in case. Urination. Urinating without a true urge trains the bladder to signal urgency at smaller and smaller volumes. Over time, the bladder becomes hypersensitive and urgency feels sudden and intense. Instead, aim for a gentler rule. Go when you feel a clear physical urge, not a worried thought. When you do go, use the 60-second routine to empty more fully. This retrains both the bladder and the brain toward calmer, more accurate signaling. Let me share a few real-world patterns I see often. Not as dramatic stories, but as recognizable experiences. One man in his late 60s described his evenings as a loop. He felt fine during the day, but after dinner, he bounced between the couch and the bathroom repeatedly. He assumed this was inevitable and tried drinking less, which only left him thirsty and frustrated. When he started sitting to urinate, adding the forward lean and the 10-second pause, something changed. A second release occurred most evenings. The sensation of incomplete emptying faded. What mattered most wasn't perfection, it was predictability. He stopped fearing bedtime because his body stopped sending mixed signals. A woman in her 50s described constant urgency paired with a sense of tightness in her hips and lower abdomen. She lived in a state of rush, rushing to the bathroom, rushing through emptying, rushing back to life. For her, the breakthrough was breathing. The long exhale became a physical key. Once she softened her jaw and shoulders, the pelvic floor followed. The second wave arrived naturally. She later shared that learning to release in the bathroom helped her recognize tension she carried throughout her entire day. Another individual, a retired teacher, described how bladder uncertainty shaped her decisions. She avoided long car rides and sat near exits everywhere she went. The routine gave her something priceless: trust. She knew that when she went, she would likely empty more fully. That certainty reduced anxiety, which in turn reduced urgency. These patterns are common, and they are human. A critical safety note. While this routine is highly effective for many people with mild to moderate symptoms, it is not a replacement for medical evaluation when warning signs are present. Seek proper medical care if you experience new or rapidly worsening symptoms, pain, burning, or fever, blood in the urine, repeated urinary tract infections, markedly weak stream or inability to urinate. Your body's signals deserve attention. Supportive techniques and medical care should work together, not in competition. Here's an easy checklist you can remember without thinking. Feet supported, gentle forward lean, 2 long exhales, stream ends, don't rush, count to 10, subtle pelvic rock, 1 more long exhale, stand calmly. If you remember only one step, remember the pause. That pause alone often changes the outcome. For many people, bladder symptoms are not isolated events. They reflect a nervous system that lives in a state of tension. Once a day, outside the bathroom, practice this. Sit comfortably, take a slow breath in. Exhale longer than you inhaled. Imagine the pelvic floor softening like a relaxed hammock. You are teaching your nervous system that release is safe. This practice is especially powerful if you've spent years bracing, stressing, or clenching without realizing it. The most important truth to remember: your bladder is not betraying you. It is communicating. Sometimes it communicates urgency because it's sensitive. Sometimes it communicates incomplete emptying because the outlet is tense or the timing is rushed. When you respond with calm technique instead of force, the conversation changes. If you remember only one sentence from today, let it be this: complete emptying is often a skill of relaxation and timing, not strength, and skills can be learned at any age. Closing message and call to action tonight. Try the routine once, just once. Notice what changes, even if it's subtle. If this video helped you, consider sharing your experience in the comments in a respectful way. Someone reading quietly may realize they're not alone. And if you want clearer, science-guided routines for bladder comfort, circulation, vitality, and confident aging, make sure you're subscribed to Urology for You and press the bell so you don't miss what's next. I'm Dr. Adriana Wells, and I'll see you in the next video.